So things we will talk about, and just specifically, I said a couple of them. So CPR is a big part of this conversation. If your heart stops, here's what CPR is. Here's what it'll do. Is that something you want to include? Number two, life support machines. And again, we talk about the breathing machines, so putting tubes in your throat. So intubation, if you hear DNI, that's do not intubate. And then there are simple things, not simple, but easier things like intensive care unit care, where you're on special medications to keep you alive if this and this happens. And as much as like this all sounds like, of course I'd want intensive care unit, these things carry a lot of side effects and complications with them. And it's not a simple yes or no. And we'll get into that in a bit. The big one people hear, and this may kind of clue people in, is DNR. It is my least favorite 3 letters. DNR means do not resuscitate. But if I poll 1,000 people about what resuscitate means, I'm going to get 1,000 different answers. And if I just ask you guys, like if someone tells you DNR, what does it mean to you? Or what do you kind of talk to patients about when you say DNR?
Yeah, I think that the DNR is often attributed with, unfortunately, not doing anything, which is not really what it is, right? Like when I think of resuscitation, really these are the invasive things that you're talking about. For the most part, it's supporting someone's breathing through a breathing tube and or chest compressions if the heart stops. So for me, DNR means that someone's not going to have chest compressions if they lose a pulse. And if they get into worsening problems with their breathing, we're not going to go to the point of inserting a breathing tube. But between those, there's a lot of other, escalations in care that can still happen, right? You can get support through things like BiPAP or CPAP. So again, people at home that might have sleep apnea might have like a CPAP machine that helps you their breathing. In the hospital, we have things like that as well that can help with people that have some breathing difficulties. So again, Josh, it kind of like you said, it's not really an all or nothing. And I don't think the checklist kind of menu type approach is helpful either, because I don't think that it's actually really fair to people to understand what these things are.